this is true. That next comment is not.
As you wish. Then I went to Georgetown University, and I directed the Lombardi Cancer Center, and with a very courageous woman named Nina Hyde, we developed the Nina Hyde Breast Cancer Research Foundation. She was fashion editor of the Post, and was just an extraordinarily brave person, and very grateful to her. It's amazing how a handful of women have actually transformed breast cancer research in this country. I mean, Evelyn being one of them, and Nina would certainly be on my list as well. From there, I went to the University of Michigan, where I was chairman of the Department of Medicine for about 8 years, and then my wife said it's too cold. And so I'm now chairman of the Department of Medicine at the University of Miami, which is a bit warmer. And what's interesting, of course, is South Florida is now 7 million people, and this is the only academic medical school in the area, and we're doing everything we can to really try to change it. Since I was here last year, I've recruited more than 100 faculty to this department, many of them doing cancer, so that's really changing. My area of interest is very simple and I think easy to understand, and it has to do with how do female sex hormones, how do estrogens act. If Larry or I or Cliff or Bill took estrogens, we would grow breasts because we have breast tissue that has the capacity to respond to estrogens, but we don't have enough estrogens in our body to stimulate it. But even though we would grow breasts, we would not turn into a breast. Remember that Alan movie where the breast gets loose in the countryside? Because the normal breast, even though it's stimulated, as for many of you, through 30 and 40 years after you went through puberty of estrogen stimulation, your breast size really didn't change much after puberty because the normal breast says enough is enough and knows when to stop growing, something that a cancer doesn't understand. So a problem that we have fastened on for a long time is exactly how does that happen? You've all heard of the estrogen receptor. You know that that's a protein to which estrogens bind, and that gets the whole ball rolling. But then what? Well, then what turns out to be a large number of different proteins that are breast-specific that get turned on. But are they all equally important, or is there potentially a handful that really are responsible for breast growth and potentially breast cancer growth, that if we could identify it might give us a way specifically of turning off breast cancer growth? Well, we have found one. It is my favorite gene. It's called GREB1. It has no other names, so you may remember GREB1 if you like. And what we've been able to show is that if we take breast cancers that respond to estrogens by growing, just like breast cancer in a woman, and we turn this one gene off, and there are technologies by which we can do that, the breast cancer stops growing. How cool is that? That's very interesting to us. So now we're trying to understand exactly what this protein does, and we are now, through a series of technologies that I won't go into unless somebody wants to ask me later on about it, in which case I will bore you for hours, we're designing drugs that specifically target GREB1 to make this into a pharmaceutical, a pill, if you wish, that would be deliverable to turn this protein off. So it isn't so much whether heat shock protein 90 will work, whether PHD1 will work, whether GREB1 will work. The point is that you're hearing smart people identifying specific putative causes. It's not just the vapors. And some of these numbers are going to come up right. Some of them will come up right. And the question is to